Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
The American Heart Association is providing new stroke guidelines for women. Many stroke risk factors are shared by both men and women, but the new guidelines zero in on those that are unique to us. In tonight's Your Health Report, we get some insight on what all women watching tonight should know. Of an estimated 6.8 million people living in the U.S. after surviving a stroke, 3.8 million are women. Cheryl Allen is one of them.
I was driving down the road, and all of a sudden, things just started kind of coming apart. Defragmenting is what I call it. By the time I got home, which was probably about 15-20 minutes later, the pain was going from my neck through my jaw to behind my right eye.
Because females are disproportionately affected by stroke, the American Heart Association for the first time is offering guidelines specifically for women. Dr. Katherine Durham with the St. Vincent Heart Clinic at White County Medical Center says some of the risk factors unique to women include different hormonal changes.
Pregnancy state, oral contraceptives are unique to women, and also the postmenopausal state and estrogen replacement therapy.
Preeclampsia is specifically mentioned as a risk. 2 of the noteworthy recommendations now being made for the prevention of preeclampsia: low-dose aspirin for women with chronic hypertension and calcium supplementation.
Hypertension, meaning high blood pressure, leads to increased risk of preeclampsia, and preeclampsia leads to increased risk of stroke.
Risks also come with hormone replacement therapy and contraceptives.
False hormones can increase our risk of clotting. So that includes oral contraceptives, and if you have high blood pressure, you're putting yourself in 2 risk categories for stroke. Women who come to their OB/GYN for oral contraceptives need to be screened for high blood pressure.
Doctors and patients are hoping this new information will help in the fight against stroke and heart disease and provide women with the important health information they need to stay healthy. And doctors say some of the symptoms of stroke in women can also be unique. In addition to the typical sudden numbness or loss of movement, women could also have vision changes like you heard the patient talk about, or severe headaches.